I'm glad you brought up the B cells, in that area, because there are people like Dr. Harry Adelson that I saw in the biohacking conference talking
Mhm.
about it and kind of, saying this is the next step of stem cells we could use more effectively and efficiently. Would it not be more effective then to put someone on a STEMREGEN supplement protocol and then provide a VSEL therapy after some time of releasing some of these to kind of really boost it? Because the same thing could be said
Yep.
about PRP or even plasma cell therapy and all these other things that you may take something like papaya seed extract to boost your platelet count and then do a systemic push of platelet-rich plasma.
Correct. So what I'm telling to you, what I'm going to say here is observations that were reported to me. We're
Mm-hmm.
doing some work right now to document it. So what I'm telling you right now is either hypotheses or coming from a few observations. So I just want this to be clear.
Sure.
But yes, if you release more V cells and you activate them, you should see it in the blood. So I was at a conference last weekend, the American Academy of Stem Cell Practitioners, and there was a fellow there who was using STEMREGEN, and what he was doing is putting his patients, on about a week of STEMREGEN, and on the morning of doing the blood draw, would have them take 6 capsules. And he said every time, he says, I see it, the column of this rich plasma, rich platelet fraction, rich platelet plasma, is about twice as big as what I normally do. So he says, now it's my protocol. I do this with all my patients. We will need to document it, publish it, but here's an observation that has been reported. One thing that we have seen so much, and I'm going back here in the early days, when we were looking at this, at AFA, the blue-green algae, and its effect on the bone marrow and stem cell release, we first did that on ourselves. So we take the product, take a blood sample before and after. So all of us in the lab, we spent maybe 2 years of doing all this work on ourselves, the dose, the mechanism of action, all of that. Once all of this is done, now we're ready to do a more complete study that we can publish. So now we put the message out, and we bring in participants to the study. We do the study, and when I analyze the data, I'm very surprised to see that my average is about half of what we have seen on ourselves for about 2 years. I'm trying to understand why. And at one point in the data, I separate the patients, the participants that I know have been consuming this blue-green algae before, and those that have not consumed it before. And I saw exactly what we had seen in the past. So the people consuming blue-green algae before had a stronger response than the new people. But I think it did not last very long. So 2-3 years later, we have almost identical response. So it brought to me the idea, which I never had a chance to test, that as you release stem cells, they go into a tissue that is in need of repair. But if they keep going in the blood and they go through the bone marrow before they reach a tissue, the bone marrow is calling back for these stem cells. That's the nature of the bone marrow. So if they don't get to a tissue, they can be brought back to the bone marrow before they reach a tissue. So as you release stem cells every day, you slowly increase that pool of stem cells ready to be re-released. And that is why we see more released in people who have taken it for a while. You kind of rebuild that population in the bone marrow. So we have a study right now where we're putting patients through about 10 days of taking STEMREGEN, and we do a bone marrow aspirate before and after to basically document the stem cell population that we have in the bone marrow. But based on these observations, based on experience by people like this doctor that I talked about before, what a lot of practitioners are doing right now is that they will start to provide STEMREGEN, let's say 7 to 10 days before, on the day of the blood draw, to do more, or on the day of the injection, if it's other types of stem cells, then you continue with STEMREGEN to just tap in the body's innate ability to repair in this process of repair that has been initiated by the stem cell treatment. So at this point, this is just dietary supplement, assistance to a treatment, but almost anybody who tries it sees the benefit.
Yeah, and you could absolutely say that as a wellness longevity product, this is, an amazing one, but also to the medical side, to the complex chronic diseases out there, where this approach of self-healing is one that most of conventional medicine just doesn't apply anymore. It's utilizing an outside drug to try and manipulate the body and basically manage a disease and bring down and subside symptoms. But that is, I believe, the future of medicine has to move into, again, breaking into our innate capabilities to self-heal and truly curing diseases.